Okay, good morning everybody. For those of you who don't know me, I'm Professor Mal Hopwood, one of the co-chairs of Equally Well Australia, and I'd like to introduce my co-chair, Dave Peters. And can I just start by saying how fantastic is it to be here face to face? You know, it's just a wonderful thing. Even feeling warm on the Gold Coast is a wonderful thing. Getting a little bit warm walking around is a good thing and kind of fits with our theme, right? I'll have some more opening remarks in a minute, but it's obviously appropriate that we start with the Welcome to Country, and I'd like to invite Uncle John Graham to join us for the Welcome to the Country. Thank you.
Thanks very much, Mel. Real pleasure to be here this morning on home turf. Come down from Brisbane this morning in that traffic, which drives you crazy. But anyway, I'm here. Bagel Yungai, Jimbalungs. G'day friends. My name's John Graham. I'm a proud Kumbamerri man, a saltwater man of the Gold Coast region. Our people are part of the wider Yugambeh language group, whose lands stretch from the Logan River in the north to the Tweed in the south, to the other side of the Great Dividing Range, out past Bow Desert up to a place called Tiviot Brook in the north, bordered by the beautiful Pacific Ocean. Kumbamerri lands stretch from the Goomera, the Coomera River, to the north, down to the Tweed, to the foothills of the mountains. It all welcomes, I like to acknowledge and pay my respects to elders past, present and emerging, because it was our old people that fought the good fight in dark and desperate times in order for people of my generation to work with other Australians towards a reconciled nation, in order for us to leave a legacy for our young people. For they're the bearers of the flame, the keepers of the knowledge, and keep our culture strong into the future. Pay my respects to all Aboriginal and Torres Strait Islander people across this nation, and pay my respects to the spirit of this land and her people, which includes all of you here today. My authority to speak comes through a warrior, my apical ancestor, who grew up on the banks of the Logan River and the Nerang River, Narangwal, place of the shovel-nosed ray. In her later life, she lived with her daughter Jenny and husband Andrew, who were the river masters of the mighty Nerang River before all the developments, the whole filling up with all the canal estates and that. It was a big, powerful river. For many years, our people were sustained by the abundance of seafood from both the river and the ocean. We remain the traditional custodians of this place because our sovereignty was never ceded, and we will be so into the future. I've had the pleasure of welcoming you here to this place, so I just ask you several things. Please respect the place that you're here, respect the fauna and flora, respect each other, and most importantly, respect yourselves. Till we meet again, Anyabu, Anyabu. See you later. Thank you.
Thank you, John. And it's a great honour to be here. A few working notes from me, if I can, just to start the morning. Just a couple of changes to the first session's structure. If some of you haven't noticed, apparently there's a thing called an election happening. And as a result, unfortunately, Ruth Vine can't join us today as a result of caretaker mode. I'm sure Ruth would very much have wanted to be here, so an unfortunate thing, but it is the nature of the role, I'm sure. And Sharon Lorne also can't join us, but we've got a more than adequate replacement, I'm sure, that Dave will introduce shortly. A couple of working notes. So today's sessions will be recorded and streamed from the auditorium. If you don't want to be identified, you can kind of see where the camera is. You can move to the left and you'll be out of shot. If that concerns anyone, I respect that. We do have a number of volunteers assisting us in each seminar room and surrounds, and you can identify them. They're wearing the Griffiths University paramedicine t-shirt. That doesn't mean automatically you need paramedicine. You might need directions or something more simple. I'm sure the other bit of news many of you are aware of is that Australian airports are having not the best week. And in particular in relation to your travel home, we're really encouraging you to register for the shuttle buses to leave the Symposium to get back to the airport. There's some information on that in the program and as an insert in your satchels. And look, we want everyone to travel well, so please, if you can try and be organised ahead, that'd be a good thing. Just in relation to COVID, the other bit of news, just in case you've missed it, we're obviously following the current Queensland COVID guidelines and the universities. We've asked everyone, we've encouraged everyone to be fully vaccinated, but we want you to be mindful of COVID and the health status and concerns of everyone else, and just practice common sense. That's our encouragement to you, as per the usual practice we've all got used to over the last couple of years. Where relevant, a quiet space is available, and if you want to access that space, just ask one of the volunteers at the registration desk and they can show you. And similarly, if anyone is feeling unwell in any way, don't hesitate to let them know and they can organise some assistance. I just want to say thank you to our sponsors, Guardian Exercise Rehabilitation. Interestingly, I'm thanking them and then they're going to make a stretch in a little while. That's a kind of mixed message in there somewhere, isn't it? But it's all a good thing. There are 2 water stations set up for you outside the atrium. It is warm. For those of us who enjoyed a walk over this morning, yeah, it's quite warm. So please don't hesitate to keep yourself hydrated. Without further ado, I'll invite Dave to the stage, but welcome to everyone, and I hope you enjoy the next 2 days.
Thank you, Mel. Good morning, everyone. I would like to acknowledge people who have a personal experience of mental illness and their families, carers and allies. The direct involvement of people with lived experience is really essential in the development of our work, and is something that we strive to include and ensure that it is both heard and actioned. While we're here, I would like to welcome our first opening speaker, who is the Honourable David Coleman, MP, the Assistant Minister to the Prime Minister for Mental Health and Suicide. And he's joining us, I think, by video conference. All right.
It's great to join you all for the Equally Well Symposium today. I acknowledge the people of the Ugamba language region, the traditional owners of the land on which you meet, and pay my respect to their elders past and present and all Aboriginal and Torres Strait Islander peoples here today. I'd also like to acknowledge all representatives across the sector, including consumers and carers that are in attendance today. The Equally Well Alliance and the Symposium co-chairs, Professor Russell Roberts, Mr Dave Peters, and Professor Mal Hopwood. I want to acknowledge the important work you have done and continue to do to highlight and help address the physical health disparity between Australians with mental illness and the general population. People with serious mental illness experience higher rates of physical illness and chronic disease than the general population. As you know, life expectancy is significantly lower for people with mental illness, up to 30% lower for clients of public mental health services. You recognise this gap and the need to address it through equity of access to quality healthcare, and I congratulate you on all you have achieved. Your vision to ultimately close the life expectancy gap is eloquently captured in the Equally Well Consensus Statement. The Australian Government's support is manifested in a number of ways. GPs, as gatekeepers of the government's Better Access Medicare items, play an important role. The Royal Australian College of GPs has committed to the Equally Well Consensus Statement. We support the GP Mental Health Standards collaboration, and their mental health training standards note the importance of addressing a person's physical health needs as part of a GP biopsychosocial assessment. Addressing the physical health needs of people living with mental illness is an important element of the government's Head to Health sites. A key operating principle of the Head to Health centres and satellites is the no wrong door entry point. As a core service, Head to Health sites provide in-house assessment, including biopsychosocial assessment, and further reviews as required. This ensures that people are matched to the services they need, including assessment of physical health needs, problems related to alcohol and drug use, and other social factors that may be relevant. Access to physical health services is either offered in-house or through seamless referral pathways and partnerships with other agencies. Where physical health needs are prominent, for example, co-occurring chronic illness, Head to Health sites assist in organising an early appointment with local primary health services. Services provided on referral include GP management of ongoing physical health issues and other physical health support services. Our support for Equally Well goes back to July 2017, when Alan Fells, as then chair of the National Mental Health Commission, launched the Equally Well National Consensus Statement. The National Mental Health Commission has led the development of Equally Well in Australia, in recognition particularly of the equity issues. This support continues through providing $1.9 million over 3 years to Charles Sturt University to continue the work of Equally Well in partnership with the Equally Well Alliance in 4 priority areas. One of those is maintaining, promoting and enhancing awareness of the physical health of people living with mental illness. Also important is facilitating collaboration and coordination across the sectors. Thirdly, supporting and developing accessible resources. And finally, monitoring and measuring progress towards improved physical health and well-being for people living with mental illness, including identification of best practice. Ultimately, with you, we want to see the life expectancy gap close. I'd like to turn now to the government's focus on mental health and suicide prevention. Mental health and suicide prevention is one of the Australian government's highest priorities. Some of our biggest investments have been in response to unforeseen events, such as the COVID-19 pandemic. Since March 2020, the Australian government has invested more than $1.3 billion into the response to the significant mental health impacts of the pandemic. This includes a substantial investment in telehealth services and in boosting the capacity of key services to meet increased demand. The government also continues to drive structural reform and real change in mental health and suicide prevention to deliver better outcomes for all Australians by building on last year's budget's $2.3 billion mental health and suicide prevention plan. Our $648 million investment in this year's budget represents stage 2 of the plan to ensure Australians can access appropriate mental health care when and where they need it. The plan comprises 5 pillars: prevention and early intervention, suicide prevention, treatment, supporting vulnerable Australians, and workforce and governance. Prevention and early intervention programs and services keep more Australians mentally well and ensure those experiencing the early stages of mental ill health can access tailored help. In 2022-23, the government is investing a further $86 million in the prevention and early intervention pillar of the plan, building on the $248 million in last year's budget. Key elements of this new investment include $63 million in support for digital mental health services in response to the ongoing pandemic pressure, including for Lifeline. This will enable Lifeline to meet increased demand for crisis support and suicide prevention. Another key investment is $9 million to help teachers and school leaders to better understand and respond to the mental health and well-being of Australian school students. The Australian government is committed to working towards zero suicides. Suicide has a devastating impact on individuals, families, and communities. The government is investing a further $46 million on suicide prevention in this year's budget. This builds on the $298 million investment in last year's budget. This year's investment includes $42 million to build on the success of recent suicide prevention trials and establish regional initiatives for suicide prevention in every primary health network. This is about strengthening the capacity for communities to implement system-wide responses to reduce the risk of suicide in their region. We're investing $30 million to establish regional and community-based suicide prevention responses nationally, delivering a wide range of prevention initiatives tailored for local communities. We'll provide $10 million to fund a suicide prevention regional response leader in each of Australia's 31 primary health networks to coordinate and drive early intervention and suicide prevention activities in each region. The government is also investing $4 million to expand on the existing research in suicide prevention by providing a further 2 years of funding for the Suicide Prevention Research Fund delivered by Suicide Prevention Australia. As part of stage 2 of the Mental Health and Suicide Prevention Plan, the government is investing $391 million in the treatment pillar. This will help to provide accessible and effective mental health treatment for young Australians, people with an eating disorder, and all Australians who require mental health support. This builds on the $1.4 billion invested in treatment in last year's budget. The mental health and wellbeing of young Australians is a priority for the government, with approximately 25% of young people experiencing mental ill health each year. We're investing $222 million to ensure young Australians can continue to access critical mental health services as they recover from the impact of the COVID-19 pandemic. This includes $206 million for the Early Psychosis Youth Program to ensure continuity of care for vulnerable young Australians experiencing or at risk of psychosis, and expanding the network through 2 new hub sites in Tasmania and the ACT. The Headspace Schools Prevention Activities Program, Flying Headspace, and the Headspace Digital Work and Study Program will also receive $14 million. And finally, YMCA Peninsula Youth Services will receive $1.6 million for the operation of Jimmy's Wellbeing Sanctuary to continue providing integrated multidisciplinary mental health and wellbeing services to young people experiencing mental ill health in the Mornington Peninsula region. Another of the priorities in the budget is helping people with eating disorders, which impact around 1 million Australians. We're investing a further $24 million to implement critical new eating disorder treatment services and to continue funding existing treatment and support services. $20 million over 4 years will be provided through competitive funding grants for specialised treatment services to be delivered in local communities. We're also investing in better integrated and holistic care for all Australians accessing mental health care. For example, $15 million will be provided for new MBS items dealing with mental health case conferencing, which help facilitate collaborative care between professionals when dealing with a person with mental ill health. As part of the government's commitment to enhance capacity within the health sector for victim survivors of family, domestic and sexual violence, the government is investing $67 million to pilot multidisciplinary care teams in 6 existing locations, delivering trauma-informed mental health therapies designed to meet the needs of victim survivors. Further, $25 million will be provided to the Illawarra Women's Centre to support the establishment of a Women's Trauma Recovery Centre. The Australian Government is investing $34 million to ensure that all Australians have equitable access to effective, culturally appropriate and trauma-informed mental health and suicide prevention services, building on the $107 million invested in the first stage of the plan. We're investing $17 million to deliver targeted evidence-based mental health support to culturally and linguistically diverse communities. $8.6 million is being provided to establish the National Closing the Gap Social and Emotional Wellbeing Policy Partnership to maintain momentum in reducing the devastating impact of mental ill health and suicide on Aboriginal and Torres Strait Islander people. The government is continuing to invest in the Red Dust program with an additional $8.5 million to provide culturally appropriate mental health support in remote Northern Territory communities focused on social and emotional wellbeing, sexual health, relationships, alcohol and other drugs, and fetal alcohol spectrum disorder. Critical to the ongoing success and delivery of the government's mental health and suicide prevention reforms is building a sustainable and skilled workforce. The government is investing $60 million in the implementation of the 10-year National Mental Health Workforce Strategy. We are, for example, investing $18 million to build a contemporary workforce and optimise the existing workforce through developing and piloting the National Mental Health Pathways to Practice program. This program will provide up to 660 supervised nursing and allied health student and graduate mental health placements in a mix of rural and metropolitan trial areas. The program will provide 75 internships for provisional psychologists in a range of settings and provide 150 free Psychology Board of Australia endorsed supervisor training sessions. A further $28 million is being provided to sustain growth in the psychiatry workforce, supporting up to 30 additional training posts. We're also investing $6 million to optimise the existing workforce by enhancing workforce capabilities and allowing people to work to the top of their scope. In addition to the Australian Government investments, A key part of our reforms is the recently announced National Mental Health and Suicide Prevention Agreement. What this seeks to create is a truly cohesive system. The National Agreement sets out the shared intention of the Australian Government and the states and territories to work in partnership to improve the mental health of all Australians. It's also about ensuring the sustainability of mental health and suicide prevention services. The National Agreement will deliver the reform needed to realise a mental health and suicide prevention system that is comprehensive, coordinated, compassionate and consumer focused. Mental health and suicide prevention will continue to be a key priority for the Australian Government. Across the 5 pillars of the Mental Health and Suicide Prevention Reform Plan, we continue to make substantial investments that will ensure quality mental health care is accessible for Australians when and where they need it. I thank you again for your important work towards ensuring the best quality of life for people with mental illness. Thank you.